So I'm from Maryland, grew up in the DC suburbs, and then went to University of Maryland for college and medical school. Decided early on I wanted to be a plastic surgeon. I actually had my nose done when I was 16 years old. I wouldn't say it changed my life or anything, but it definitely gave me exposure to plastic surgery. But about a year in, I realized I loved anatomy and I loved surgery, and so I committed to surgery, and then quickly realized that I wanted to be a plastic surgeon. I spent 3 years in Dallas. It was a really amazing time to be there. At that time, it was like the mecca of plastic surgery. We redefined the anatomy of the face. I helped discover the fat compartments and the membranes that separate them, and we really took facial anatomy to the next level, and really laid the groundwork for a lot of the stuff that we're doing now with injectables and deep plane facelifts, and it's something that I'm really proud of. And I still visit a ton of plastic surgeons. I did a rhinoplasty fellowship in Europe to learn how to do preservation rhinoplasty to get better at closed endonasal rhinoplasty. I read all the time, just really dedicated to becoming the best that I can be. And it's a nonstop process. The number one thing is I want to deliver value to my patients. I want them to feel like the money they spent, the downtime they had, and just going through surgery was worth the result that they got. Second thing is patient communication. Patients have to be prepared for what they're undergoing. It's almost impossible to conceive that someone can really understand exactly what they're going through until they go through it. So we really spend a lot of time educating patients on downtime, potential complications, risks, where your scars are going to be, what to expect, because surgery's a real deal, and you can have a lot of swelling, you can have temporary loss of function. It's no joke, and so we really make sure our patients are well prepared for surgery. If you are having plastic surgery, you have to go to a plastic surgeon who is board certified by the American Board of Plastic Surgery.